Welcome back. Today we are hitting cranial nerves with 10 Harvard-style exam questions and answers. Why cranial nerves? It's because they show up on every anatomy, neuro, and clinical skills exam. And they are high stakes. Miss cranial nerve number 3 on a patient with a blown pupil and you will miss a life-threatening aneurysm. We'll go from memorizing all 12 to testing function and then to real clinical scenarios. Suppose after each question, answer it first, then check my answers. Let's start. Question 1. Name all 12 cranial nerves in order and state if each is sensory, motor, or both. The answer? Use the mnemonic O-ho to touch and feel very good. Velvet. The first O is olfactory nerve. It is a sensory. Olfactory nerve is for smell. Number 2, optic nerve. It is sensory for vision. Number 3, oculomotor. It is motor for eye movement, pupil constriction, and levator palpebral muscle function. Number 4, trochlear. It is motor and supplies the superior oblique muscle. Number 5, trigeminal. It is both sensory and motor. It is for facial sensation and muscles of mastication, innervation. 6, abducens. It is motor and supplies the lateral rectus. Number 7, facial nerve. It is both sensory and motor. It is for facial expression, taste, anterior 2/3 of the tongue, lacrimal, for salivary glands, innervation. Cranial nerve number 8, vestibulocochlear nerve. It is sensory. It is for hearing and balance. Cranial nerve number 9, glossopharyngeal. It is both sensory and motor. Plays a role in the taste sensation and supplies the posterior 1/3 of the tongue. Also used in gag reflex and salivary glands innervation. Cranial nerve number 10, vagus nerve. It is both sensory and motor. It supplies the laryngeal muscles and plays a role in parasympathetic to thoracic and abdominal organs. Cranial nerve number 11, accessory nerve. It is motor. Supplies the sternocleidomastoid muscle and the trapezius. Cranial nerve number 12, hypoglossal nerve. It is motor and supplies the tongue muscles for tongue movement. So, cranial nerves number 5, trigeminal. Number 7, facial. Number 9, glossopharyngeal. And number 10, the vagus nerve, all are both sensory and motor. Question 2. A patient cannot elevate or depress the eye when looking medially. Which cranial nerve and muscle is damaged? The answer? Cranial nerve number 4, trochlear nerve. This nerve innervates the superior oblique muscle. Clinical test. Have the patient look down and in. If they can't, suspect the cranial nerve number 4 palsy, because the patient here will tilt the head to compensate. Question number 3. A patient has a blown pupil. One pupil is fixed and the other one is dilated. What's the most dangerous cause and which nerve is involved? The answer? Cranial nerve number 3, oculomotor nerve compression. The most dangerous cause is the posterior communicating artery aneurysm. Why is this question high-heeled? It's because cranial nerve number 3 carries parasympathetic fibers for pupil constriction. So compression of the oculomotor nerve is a medical emergency. Question 4. A patient cannot close their eye, has loss of taste on the anterior 2/3 of the tongue, and dry eye. Which nerve and where is the lesion likely? The answer is the cranial nerve number 7, the facial nerve. So the combination of motor plus taste plus parasympathetic loss means the lesion is proximal to the geniculate ganglion. Clinical diagnosis, we can have Bell's palsy if it is idiopathic, but always rule out brainstem stroke. 5. A patient has decreased gag reflex and hoarse voice. Which cranial nerves are tested and what do they do? The answer, cranial nerve number 9 and cranial nerve number 10 were tested. For gag reflex, cranial nerve number 9 is afferent and cranial nerve number 10, the vagus nerve, is efferent. Hoarseness of voice comes because of cranial nerve number 10 damage to recurrent laryngeal nerve. Yes, damage to the recurrent laryngeal nerve brings about hoarseness of voice. Clinical exam tip. You say, ha! Then you look at the uvula, which should rise in middle. So any deviation means cranial nerve number 10, the vagus nerve palsy. Question 6. A patient cannot shrug their shoulders or turn their head against resistance. Which nerve and muscles are affected? The answer, cranial nerve number 11, the accessory nerve. This nerve supplies the trapezius muscles and the sternocleidomastoid muscles. Take note, cranial nerve number 11, the accessory nerve, is purely motor and it is often damaged after neck lymph node dissection. Question 7. A patient has vertigo, nystagmus, and hearing loss. Which nerve is affected and what are its two components? The answer, it is the cranial nerve number 8, vestibulocochlear nerve is affected. This nerve has two components. It has the vestibular part for balance and the cochlear part for hearing. Clinically, suspect cranial nerve number 8 lesion if the patient has vertigo plus hearing loss. But if the patient only has hearing loss, suspect the cochlear nerve or cochlear part of the vestibulocochlear nerve lesion only. Question 8. A patient has loss of facial sensation on one side and cannot chew. Which nerve and what are its 3 branches? The answer, it is the cranial nerve number 5 which is affected, the trigeminal nerve. This nerve has the following branches. We have the ophthalmic branch, maxillary, and the mandibular branch. To test the trigeminal nerve, you can do the light touch on the forehead, on the cheek, and on the jaw. Also, you can test the jaw clench for motor. Did you know the trigeminal neuralgia causes a severe facial pain in V1 to V3 distribution? Question 9. A patient has anosmia after head trauma. Which nerve is injured and Why is this clinically important? The answer: cranial nerve number 1, the olfactory nerve, is injured. Fibers of the olfactory nerve, they pass through the cribriform plate, and they are easily injured or sheared when there is a head trauma. You know, anosmia plus the cerebrospinal fluid rhinorrhea means there is skull base fracture. Question 10. A patient has a tongue that deviates to the left when protruded. Where is the lesion? The answer: the lesion is found in the cranial nerve number 12, the hypoglossal nerve. Injury to hypoglossal nerve causes the tongue to deviate toward the side of the lesion. That's it for cranial nerves. If you can name all the 12 cranial nerves and even link each to a clinical finding, you are exam ready. Drop your score in the comments below, and don't forget to like and to subscribe to my channel. Thanks for watching. Keep drilling these nerves. They will save your patient one day. Bye.